Today on the Operators Podcast, we have Sarah Long, who is an expert in billing as well as a clinic manager. We spoke about the clinic, her career path, and as well, we spoke a little bit about Northwestern Arkansas. So I hope you enjoy. What is your kind of origin story? Like, where did you get started, and then how did you become who you are today in your current position?
Yeah. Yeah. So, I originally thought I was going to be an architect, and that's what I went to school for. And life took me in a really different direction and kind of threw me into healthcare. So I started working for a large hospital system in Springfield, Missouri. And it was kind of a unique role. I was the executive assistant support for vice presidents and physician leaders. And in that role, I really had a unique opportunity to, I would say, be in the room, not necessarily at the table, but in the room, watching how decisions were made, watching how operations and clinical leaders went through the process of trying to continue to carry forward the organization and make sure it was going in the right direction with all of the headwind nuances that come with that. I also had an opportunity to really network and build relationships with a lot of the middle management within the hospital. So, hospital operations is incredibly complicated. It's a 24-hour business built around patients, but also balancing the coworker experience at the same time. So I got to see how they managed their teams and managed initiatives and changes. Um, from there, I wanted to learn clinic operations. So I moved over to the clinic side and stepped into a manager of operations role where I was the interim. So when an
Mm.
individual left a clinic, they asked me to step in while they were recruiting so that that team would be supported. And I think over the course of a few years, I had the opportunity to really embed myself in all of the ologies. So, every ology you can possibly imagine, neurologies and the neurosciences, oncology, GI, infectious disease, dermatology, all of those ologies. And really started to love operations, loved just being able to support teams, figure out what their pain points were, bring in solutions, and really kind of build them and grow them. I started collecting clinics. So I kind of stopped letting them go. I was no longer the interim and started kind of staying as their leader, and grew in just that operational support capacity. Then found that I needed to balance my life a little bit more. So I stepped out of operations and I got my coding certification.
Oh,
So
really?
the behind the scenes of medical billing and coding and insurance companies and all of the guidelines, the payer guidelines and incentives and the different ways that um, they build a web for you to get reimbursed. And I ran some billing teams for a few years. I learned rural health in those years and federally qualified health center FQHC billing as well, which is slightly nuanced to what you would see in a hospital setting or even in private practice.
Mm.
After a few years of that, I really missed operations. So I stepped back into operations, but I actually stepped into oral health. So the dental side of healthcare. And I had a wonderful opportunity to be mentored by some dental leaders who were dentists themselves and really shed light on how the dental world can bring efficiencies into healthcare, and how we can really learn from some of those practices that they've had for quite a long time and some of the simplicities of it. So I spent 6 years learning oral health and continuing to support a little bit of medical as well. Stepped into optometry, learned about vision health, and all those things. So, and then recently transitioned into private practice. So, kind of rounding out my hospital and clinic and rural health, and nonprofit FQHC to private practice with a pediatrician group.
Hmm. So yeah, it's quite a resume. So what do you think then people maybe don't understand about clinic operations? Like, is there any kind of unique insights you can give into that field?
You know, I don't think we bring enough integration and collaboration. I think there's a wonderful opportunity, and something that I like to do with all of my teams is really identify who is missing from this table as we're talking through process improvements. And sometimes that ends up being the team members on the floor. Right now, we're looking at our exam room space and what that space needs to look like. And so I asked them, as leaders, we can make these decisions, but ultimately, we don't live in those rooms. Our nursing staff does.
Mm.
So, what nurses could we bring to the table as part of this conversation to build this around their daily environment? Um, I think one of the best examples of that is also seen at the FQHC I worked at, where you've got medical and behavioral and dental all at the same table trying to work through those workflows and learning from each other. So don't be afraid to invite some additional people into the conversation.
And are you working remote now, or are you in-house?
I'm in-house. I'm a people person. I have done some work on the side that is remote, and I really enjoy it. But
Hmm.
I really like that interaction with people as well.
That's awesome. Yeah. I don't know if you could be like an operations manager and work remote. That's kind of why I asked about it. I think it would be tough.
Yeah,
Biller maybe. Biller probably you could work remote, but I don't
yeah.
know if an operations manager could.
Well, and billing and coding in the medical arena is really the standard is remote work.
Yeah, I've
And
noticed that a
so
bit.
it's easy to measure as well. You know, the are you getting your work queues done? Are you sending out your claims? Are you working your denials? It's simpler to measure. Operations is a little more complicated. I do think there are some roles that you could do that with. You'd really have to build a strong team that was aligned well in order to accomplish everything you need to.
Yeah. So let's go back then to billing. What's your experience as like a biller in the US? Like, is there any kind of unique insights into that field you could give potentially?
Mhm. So one of the things I would tell everyone is your revenue cycle is only as strong as your ability to pull reports and data to identify the trends.
Hmm.
And a lot of EMRs have a lot of reporting capabilities that are not fully leveraged.
Mm.
If you can identify those trends, you can identify where you have that leakage. And then I would work backwards. You know, here's what we're seeing, here's where we have leakage, here's where we're not achieving what we need to achieve in our reimbursement percentages, and then how can we adjust that process. But then again, it starts in the clinic. And so you've got to be able to walk that process all the way back to the beginning or the on the floor user. Um, the dental world is incredible at doing this. Anytime you go to the dentist, your front desk receptionist is the one who understands how to collect your copay, how to query your insurance for how much you owe, submitting authorizations. They probably were a dental assistant at some point, so they know
Mm.
everything about the anatomical mouth, and everything that's going to happen in the back. And I think that's a huge asset because they can see the full scope, the full picture of what's going on. And I think we miss that a little bit on the medical side. So, um, the reporting, I think, is incredibly important to identify those trends. But then, really, and I call it field trips. I love to take my team on field trips. So I would take my billers to the clinics and we would sit down with the operations team and really talk through the workflow and say, this is what we see at the end of your process where we pick it up and create a claim. And, is this what we want to see? Is this creating a simplified revenue cycle?
Mm. Are you still doing anything with revenue cycle management now, or like as a operations manager, or is that completely just now not your focus?
I pull revenue cycle into my operations. So I'm looking at my days in AR. I'm looking at my collection percentages. I'm establishing KPIs for my operations team and pulling them into it as well. We look at our denials, but we also look at the payer guidelines. So if I can understand the insurance company's rules and how they want me to function, then I can somewhat beat them at their game.
Mm.
And so, that's important as well, is to understand the we'll say the guidelines that influence the backside of things. Doesn't necessarily change what you're going to do or what your clinicians are going to do, but understanding it helps you have that picture.
Yeah. It's interesting. I've spoken to a couple of people, just generally speaking, who they have like their AI startup or whatever that's going to be the RCM startup that's going to fix all the RCM problems using AI. And I haven't really like, first of all, no one's dominated the space yet. Like there isn't like that, like this is the company that does ARCM. It's still open. You can still seize the market. But every single person I've spoken to has a different idea of how they'll fix the problem. Like it's
Yeah.
like, uh, for example, Caesar Health, in our eyes, it's like, okay, note taker will collect the notes and it will fix the problems at the ground level with note taking. But then I've had a lot of other people that are saying like, oh no, it's gonna just collect the data from the EMR and it will just give you suggestions off that data. I've had just like, and then there was this other lady who had her own version of it. It's just everyone had their own thing. In your eyes, like, what's your dream RCM? So, like anything with EMR and all that stuff, like the dream solution for the future.
Mm. I think revenue cycle comes from multiple streams, right? So I have my physician who's doing the chart notes, who's dropping a level of service. I've got my payer incentive programs, and there are a few other revenue streams, right? And so I think ultimately, if you could combine maybe even just two or three of those, I think would be a huge advantage. Right now, I am creating a process where we can make it's an electronic process from a manual process that
Hmm.
links up in the EMR we use, which is ECW, and interjects all of the coding queries that the insurances want. So let's say you went to a primary care, they diagnosed you with asthma. You haven't seen that primary care again. You reestablish with a different primary care. Your insurance sends your new primary care a note that says, Benjamin has asthma. We don't know if it's still there, if it's resolved, if it's stable, if it's exacerbated. Can you let us know, right? The insurance companies want to data mine this information because they're measuring the complexity of your health through claims and diagnosis codes. They're willing to incentivize your new primary care to say, yes, asthma is still present, or nope, it's resolved. He's grown out of it, right? And so right now, that information is housed in one bucket, whereas my EMR is in another bucket. And I have to manually translate it over to
Hmm.
understand here's a diagnosis I want you to pay attention to as a clinician. Let me know if it's still present or not. Not taking the decision making away from you, but I need to let somebody else know, the insurance company, that it is still there or it isn't there. And they're willing to incentivize me if I answer that question.
Hmm.
That integration integrates two different revenue streams within your revenue cycle. My clinical claim still goes out the door, but then I also receive that payer incentive for them having an understanding of the data. They can collect claims data, but they want to know in a timely manner. They want to know in advance, all of those things. They want to know if it's been addressed. an interesting example, I tell my physicians, every year, let's say you have a limb amputated. Every year we have to tell
Mhm.
your insurance company it's still amputated. It didn't grow back miraculously. And so if we don't put that diagnosis on one of the claims during the year of 2026, your insurance company goes, well, is it still amputated? What's going on with it? Has it resolved? Is it still present? All that. And that kind of seems pretty distant to me as far as it should be easier to determine certain things aren't going to resolve themselves. So I think integrating some of those pieces, because in the claims process, it's still pretty messy. But if I can offset and build in either more software or more staff, I can use some of those incentives to offset the expense of it to give myself some efficiencies.
Mm. That's kind of interesting. I've never heard that before. Hmm. Sounds like a big project, though.
It is. Well, so we literally, and this is going to make you laugh, we literally had team members that were printing off pieces of paper and trying to chase down the physicians to say, does Benjamin still have asthma? Can you check this box and incorporate it into your clinical notes so that we can also tell the payer that this exists or is still present?
Mm.
And so we're taking that and we're working on creating an electronic process where we put those notes into the chart. So as you check in for your appointment and the physician pulls up the notes from the chart and their templates and all of those things, they
Hmm.
see that note from us that says, please assess asthma. Is it still present? Is it resolved? Those pieces. Now, I will say some of those limitations are the EMR that we have, right? We don't have Epic. Epic is wonderful and amazing. But I think understanding how you can leverage, those EMRs. So I've taken a process of printing paper and chasing people down to an electronic version of a heads up and asking the physician to look at things, look at diagnosis.
Yeah. So I kind of wanted to ask you a bit, like, what's it like living in Arkansas? Was my sort of Arkansas question.
Yeah. So it's really interesting. I don't know if you have ever done any research on Northwest Arkansas, but I read an article a few weeks ago. 40 people a day relocate to Northwest Arkansas.
Isn't it
Uh,
incredibly like wealthy? This guy from Arkansas explained it to me that there's some reason it's very wealthy. I don't remember why.
so you've got
Companies there.
Yeah, you've got three major companies that kind of are headquartered here. You've got Walmart, so you have the Waltons.
Yes,
You've got
yes.
Tyson Chicken, right? And then you've got JB Hunt, which is transportation. And one thing that Walmart did years and years ago when they first started was they put in a requirement that any business that they do business with, any organization that a vendor that they do business with has to have a headquarters in the Bentonville area. And
Mm,
so that pull, and especially as prominent as Walmart is across the United States, that pull pulled in corporate headquarters. Cost of living was low when this happened. They lots of space in the Midwest to build large buildings. And so you have a mecca of of businesses and organizations that are here that are very present in the community. And especially in those three organizations, so Tyson, Walmart, and JB Hunt, they have invested in the community as well. So Northwest Arkansas has become the one of the top destinations for mountain biking and trail biking because that was an interest of one of those families, and they built it out within the community, all the trails.
yeah, it's awesome. I think in America, I like when things kind of gravitate away from New York and Florida and whatever. Like, there's no reason why businesses need to be centralized. I think it's really interesting that Warren Buffett built this like $1 billion empire, and he stayed in Omaha. He's like, I don't need to leave Omaha. I'll just stay here. It's one of
Yeah,
the biggest companies in the U.S. It's
yeah,
awesome.
absolutely. Absolutely.
So I don't like to keep these podcasts too long. Like, is there anything else you think that'd be worth chatting with? Um, any other kind of key insights you have?
Mm. I think kind of relating it back to AI, I think one of the biggest opportunities is looking through a different lens. I would say one of the biggest assets and knowledge that I gained that has benefited my medical clinics is what I learned in oral health.
Mm,
And even from an AI perspective, if I was going to build an AI platform, I probably would go back to a dental clinic and really try to understand how it would integrate into that world, where the offices are run so efficiently, and then try to translate that out to a medical world and a medical operations. Because I think there are a lot of key pieces that can be moved over and hugely
mm.
beneficial.
Yeah, and I've heard this before. What do you think makes a dental clinic so much more efficient than a medical clinic?
They measure things differently. So, in a dental clinic, you measure the amount of time the dentist is doing dental work
Hmm.
because the billing is essentially done by the dentist, right? And so you measure essentially how long they're sitting in that exam room and how much time it takes them to get from one exam room into the next exam room and what stops them along the way or what pauses them in that process. They have created in their dental assistants greet the patient, seat the patient, take x-rays, do the polishing of the teeth, right? So really have laid on the dental assistants everything that they can do within their scope of practice. And now I don't have a dentist that's doing those simplified things. A dentist comes in, he looks at the x-rays, he checks the teeth out, makes narrative notes. Your dental assistant is your scribe, right?
Hmm.
They're charting everything for you.
Hmm.
Dentist says, everything looks great. Come in 6 months. We'll see you again. We've got some areas that we need to watch or look out for, but keep flossing, keep brushing. They leave, they go into the next room. Dental assistant finishes up that examination, walks you to the door, schedules your 6 month follow up.
Hmm.
Leveraging that staff is huge. And it allows your dentist to only be in the room for the meaningful work that they can do. Medical hasn't figured that out yet.
I feel like
Medical has,
dermatologists have and no one else has. Derms are they have like nurse practitioners usually and stuff. But you're right, yeah.
yeah.
Um,
I agree with
there's
you. My derm clinics were pretty efficient.
yeah, derms don't mess around, but some other clinics might. I
Yeah.
think that there's a great opportunity to leverage super efficiency and maybe in a cash pay scenario, pass on that efficiency to patients in the form of cheaper care. And I think that would be an amazing, amazing thing if that could happen.
Yeah.
And I know some people are
Yeah.
attempting it. So
Well,
we'll
and the
see what
cost of
happens.
healthcare too, I think that would be huge.
Yeah. Or you could be a capitalist and you could just pocket it yourself, buy a sports car. It's up to you.
Yeah,
Well, anyway, thank you so much, Sarah, for coming on. I really appreciate it.
absolutely. Thanks for your time today, Benjamin.
Yeah, I'll edit this episode and I won't post it without running it by you if you think there's something that should get deleted or cut or whatever.
Yeah,
Um,
yeah,
yeah,
sounds good. I appreciate the opportunity.
yeah. If you ever want to build like an AI tool for Mana, let me know. I can work with you to develop it, whatever it
Okay,
may be.
okay. Let me get the first layer of getting rid of the paper out of my processes, and then maybe I'll call you and say, okay, I'm ready for more. I've gotten rid of the paper. Let's go AI.
Well, if there's something in your head that you think would be like something that would really improve the clinic, then
Mhm.
uh, then you know that we could make it for you if you know, but
Yeah.
it's just on you. If there's something that you want to envision in your mind, you know.
Yeah. Yeah. Absolutely. Absolutely.
Okay. All right.
Yeah.
Have a good rest of your day, and
All right. You too.
keep in touch.
All righty. Bye.
Okay.